1. Florida's flesh-eating bacteria. What you need to know. 2. The dangers of flesh-eating bacteria in Florida waters. What you need to know. 3. Flesh-eating bacteria. The deadly threat in Florida's waters. 1. Florida's flesh-eating bacteria. What you need to know. Imagine soaking up the sun on a beautiful Florida beach, only to hear that a flesh-eating bacteria has claimed 4 lives this year. It's a chilling thought, but it's the grim reality we're facing. But here's where it gets controversial. The bacteria responsible, Vibrio vulnificus, is naturally occurring in our coastal waters, and its numbers are on the rise. State health authorities have reported 11 infections this year alone, with fatal cases occurring in Central Florida's Bay, Broward, Hillsborough, and St. Johns counties. Dr. Daniel Egan, an infectious disease specialist, explains that Vibrio vulnificus is a saltwater bacterium that thrives in brackish seawater. It's not your typical beachgoer's concern, but it's definitely something to be aware of. This rare infection usually spreads through open cuts and can be contracted by eating raw shellfish, particularly oysters. For most people, the symptoms are relatively mild. Think vomiting, diarrhea, fever, and chills. However, for those with weakened immune systems, the consequences can be dire, leading to fever, chills, septic shock, skin lesions, and even amputations. In rare cases, the infection can cause necrotizing fasciitis, where the flesh around an open wound dies. And this is the part most people miss. The infection can be fatal in about 50% of cases where it enters the bloodstream. The Centers for Disease Control and Prevention report that 1 in 5 people who contract this infection die, sometimes within just a couple of days. And the numbers are rising. Last year, Florida saw a record 19 deaths in 82 cases, marking a significant increase from the previous year. The culprit? Late-season hurricanes that pounded Florida and the southeast, causing saltwater to move inland and people to come in contact with contaminated water. But here's where it gets even more complicated. Climate change is playing a role. Warmer temperatures are leading to more frequent and severe hurricanes, providing the perfect conditions for Vibrio vulnificus to thrive. The Department of Agriculture projects that the costs of Vibrio infections could skyrocket from nearly $2.6 billion in 1995 to a staggering $6.1 billion by 2090. The good news is that you can protect yourself. Avoid eating raw shellfish, keep open wounds away from warm salt or brackish water, and wear protective clothing. But researchers at Florida Atlantic University warn that Vibrio pathogens are adapting to stick to microplastics, and they can combine with sargassum blooms that often plague Florida's shores. So what do you think? Is this a problem we're taking seriously enough? Or are we underestimating the risks of these flesh-eating bacteria? Let's start a conversation in the comments below. 2. The dangers of flesh-eating bacteria in Florida waters. What you need to know. Imagine a microscopic threat lurking in the warm waters of Florida's coastlines, silently waiting for the perfect moment to strike. This is the reality with Vibrio vulnificus, a rare but deadly bacterium that has claimed 4 lives in 2025 alone, despite a drop in cases compared to the previous year. But here's where it gets controversial. While officials celebrate the decline, data reveal the danger is far from gone. Let's unpack why this flesh-eating bacteria remains a hidden menace, even as the numbers seem to improve. Florida health officials have confirmed 11 cases of Vibrio vulnificus in 2025, with 4 tragic fatalities. This marks a sharp decrease from 2024, when Hurricane Helene's aftermath led to a surge of 82 cases and 19 deaths. But what caused that spike? Experts speculate that the storm's surge of warm, brackish water created ideal breeding grounds for the bacteria. And this is the part most people miss. Even as cases decline, the underlying conditions like rising sea temperatures due to climate change could keep the threat alive for years to come. The 2025 deaths span multiple counties, including Bay, Broward, Hillsborough, and St. Johns, with additional cases popping up in Duval, Escambia, Lee, Manatee, Santa Rosa, and Walton. Dr. Edward Hirsch, an infectious disease specialist, warns that the most vulnerable are those with weakened immune systems, such as cancer patients, individuals with liver disease, or anyone on immunosuppressive treatments. Symptoms range from blisters and swelling to severe gastrointestinal distress, and in worst-case scenarios, the infection can literally eat through tissue, creating open wounds. It progresses to making a hole in whatever part of your body got infected. Hirsch explains, a chilling reminder of the bacteria's ferocity. So, how do you protect yourself? Prevention starts with simple habits. Rinse off thoroughly after swimming in ocean water, especially if you have cuts or abrasions. When it comes to seafood, cooking shellfish like oysters to an internal temperature of 145 degrees Fahrenheit is non-negotiable. Cross-contamination in the kitchen is another overlooked risk. Store raw and cooked foods separately, and refrigerate leftovers promptly. But here's the catch. Even with these precautions, Vibrio remains a ticking time bomb for those in high-risk groups. The CDC estimates 80,000 Vibrio cases and 100 deaths annually in the U.S., though infections are rare. Diagnosis requires specialized lab tests, and early treatment with antibiotics is critical. Yet, as Hirsch notes, it's very frightening. Luckily, it's very rare. That duality, rare but devastating, fuels debate. Should public health campaigns focus more on awareness for at-risk individuals? Or is the decline in 2025 cases just a statistical blip? And what about the role of climate change in creating environments where Vibrio thrives? We'd love to hear your thoughts. Is the real danger not the bacteria itself, but our ability to prevent exposure? Share your perspective in the comments below. For now, the message is clear. Stay vigilant. Whether you're a Florida resident or a visitor, understanding Vibrio's risks and taking proactive steps could mean the difference between a safe summer and a life-threatening encounter. For more details on symptoms, prevention, and treatment, visit the CDC's Vibrio page. Stay informed, stay safe. 3. Flesh-eating bacteria. The deadly threat in Florida's waters. Imagine stepping into the warm waters of Florida, only to find yourself at risk of encountering a deadly flesh-eating bacteria. This may sound like a horror movie plot, but it's a harsh reality that has already claimed the lives of 4 people in the state this year. The culprit behind these tragic deaths is Vibrio vulnificus, a type of bacteria that is commonly found in coastal waters. But here's where it gets alarming. This bacterium can cause severe illness and even death, especially for those with weakened immune systems. According to the Florida Health Department, a total of 11 people have contracted the bacteria in 2025, resulting in 4 fatalities. But what exactly is Vibrio vulnificus, and how can you protect yourself from its deadly grasp? To understand the risks associated with this bacterium, it's essential to know that it typically lives in warm, brackish seawater. When people with open wounds swim in these waters, they can become infected. Another potential source of infection is raw shellfish, especially oysters. The Centers for Disease Control and Prevention (CDC) warns that Vibrio vulnificus can cause an illness called vibriosis, which is often marked by vomiting, diarrhea, and abdominal pain. In severe cases, it can lead to potentially deadly skin infections. The signs and symptoms of a Vibrio skin infection include fever, redness, pain, swelling, warmth, discoloration, and discharge. While healthy individuals may only experience mild symptoms, those who are immunocompromised or have chronic liver disease are at a higher risk of serious health complications. But here's the part that's most concerning. If Vibrio vulnificus enters the bloodstream, it can cause severe illness marked by fever, chills, septic shock, and blistering skin lesions. About half of these bloodstream infections are fatal, and some severe cases can even cause an infection called necrotizing fasciitis, where the flesh around an open wound dies. This rare but deadly side effect has led to Vibrio vulnificus being described as a flesh-eating bacteria. So, how can you diagnose and treat this infection? The bacterial infection is typically diagnosed by testing cultures obtained from stool, wounds, or blood. For mild infections, increasing fluid intake to prevent dehydration is recommended. However, those with severe or prolonged infections should receive antibiotics to improve survival rates. In some cases, surgery may be necessary to remove dead tissue. The CDC also warns that about 1 in 5 people will die from the infection, sometimes within a day or 2 of illness. But there are steps you can take to protect yourself from this deadly bacterium. Health officials caution against entering warm saltwater or brackish water if you have any fresh cuts, scrapes, or wounds. It's also recommended to avoid consuming raw oysters and other raw shellfish, and to prevent cross-contamination of other foods with raw seafood or its juices. Additionally, Wearing protective gloves when handling raw shellfish can help reduce the risk of infection. Certain individuals, such as those with liver disease, cancer, diabetes, HIV, or thalassemia, are at a higher risk of complications and should take extra precautions. As we reflect on the devastating impact of Vibrio vulnificus, it's essential to ask, are we doing enough to prevent these tragic deaths? Should we be taking more aggressive measures to warn people about the risks associated with this bacterium? And what can be done to support those who have been affected by this deadly infection? We want to hear from you. Share your thoughts and opinions in the comments below. By understanding the risks and taking the necessary precautions, we can work together to prevent further tragedies and keep our communities safe.